After the stroke, everything in my life changed. I was an associate consultant dermatologist and I was also a model. After my stroke, I couldn't do both of these.
I can remember very clearly when I brought her home. She cried when she looked at her own photo. She told me, say, "Mommy, I will stop crying. You don't have to worry, Mommy. I will recover. I know that I can." She never threw a temper at all. Because during the rehab, I said that you must build your strength by demand because Mommy want to bring you home.
So now I'm running clinics under supervision by Professor Derek Au. I think it has been very meaningful because I'm able to see patients and help them directly.
She loved her job. She loved to see patients. One day, she will go back to her own clinic.
8 months adalah, he kena, then I kena. When I okay, my daughter accident, injured. I do my husband first. I also take care myself. I bring my daughter first, but they cannot walk. They cannot everything. They cannot buy use pampers. Everything I do for my daughter lah. And then social welfare ask me where you get money when you makan. I said I'm selling kuih.
Sometimes I feel very weak. I just don't know what happened.
I have to carry. So heavy.
Thank you, my wife, for helping me all the years. I pray for you, man. Long life, man. Healthy.
Abang pun nak doakan Mak juga. Supaya Mak sihat, jaga abang.
He has a very rare genetic condition called CDG type 1J. His care typically is 24/7. He has a background of seizures. Last night wasn't a good night.
Yeah.
So when he fall asleep, deep sleep, then his oxygen will start to drop and his machine will start beeping. So basically, throughout the whole night, every hour or so, it is beeping. So over the years, Kason grew stronger. We understand him better in terms of his needs.
When the oxygen is stable the whole day and we don't need to do any suctioning for him, and then we can bring him out and wherever we see him happy.
Why do I bake? I bake because I like to share love and joy to the people I meet. I bake blueberry muffins and I also bake a pineapple tart blondie. To the patients, it's okay to be afraid, but also know that you're not alone, you got your loved ones around you.
Knowing that vasculitis is rare, I thought I would just, try to find someone else with another condition. And that is how then I got to meet different people with different kind of autoimmune diseases and got to hear their stories. And I think that's how I got into patient advocacy. Through SPAN, we also get to work with healthcare professionals on the same level, to get them to understand what is patient-centered care. My philosophy is just to live life as purposefully as I can. That's how I founded Be Kind SG. So it is a group that supports people with disabilities, focusing on autism spectrum disorder and intellectual disabilities.
When you go through chemo, your fingers actually suffer from a lot of neuropathy. Watchmaking allows me to manage very intricate hands and dowels. You just try to cope with it and manage during the period when you're a little bit feeling disabled. After having my bone marrow transplant and having 100% in remission, actually my strength is even stronger than before. And it actually takes a community to restore a man. I also begin to understand what SES represent, what kind of community outreach they are doing. And personally, I have a pain point with navigating health insurance. Driven by this motivation, I volunteered and joined and participated with some of the SES activities. So the recent one was about cancer inclusivity. How does cancer inclusivity look like at the workplace? The community here being Singapore Cancer Society, SGH, as well as my employer, ACS Independent. Collectively, they enabled me to return back to work.
It was Geeta herself who had the courage to fight through for so many years. When she was diagnosed, she was already stage 4 breast cancer. The last surgery that she had, she was totally permanently disabled. She could not do any activities on her own. She was fully bedridden. First few months in the hospital was really tough. Everything was new to me. The doctors and nurses helped me a lot to go through the caregiver training. We were hoping that she would get her mobility back over a period of time. The reality was it would never happen, but we did not want to accept the truth. Me also being a technical person, I wanted to explore a lot of things. And hoist was something that I saw in the hospital. And then we used the harnesses to see how she can make her stand up and then see how she can move and things like that. She was such a loving mom. She really wanted to see how the children's schools and classes would be. So we managed to show her around the campuses, show her around the dorm. It was one of the most happiest moments that we had.
To be a recipient of liver transplant, it's a chance to see my children growing up. During one of my visits to transplant center, my doctor asked me if I'm still playing tennis. And he told me, Galina, you're gonna go for transplant surgery, and after that, you have to make me a promise that you will go for World Transplant Games and win gold for Singapore. In Germany, in Dresden, in August 2025, we have gotten gold medal for Singapore in doubles. I'm very proud to be Singaporean, to be honest. It was unbelievable to see all the athletes from more than 90 countries, all with different stories.